Hi there. A very common problem people have these days is carrying a lot of tension in their shoulders. And if they're really tight and bunched up, you see just that happening. The shoulders are elevated, they're often rounded forwards, and we carry all that tension up here, and it can be quite difficult and stubborn to try and reverse. So although one technique is never just enough to sort out a problem, the technique I'm going to show you here aims to stretch the upper shoulders utilising muscles lower down, and is a nice tool to have in that whole kind of toolbox for managing tension in and around that area. Now this is going to primarily utilise a muscle called the latissimus dorsi, which is a huge muscle running down the side and back of the body. Of course, there can be other muscles involved as well, and collectively these muscles do what's called depress the shoulders. So elevating the shoulder blades come up and around and the shoulder girdles lift, depressing the shoulder blades draw down. Now the latissimus dorsi attaches to the head of your humerus, but it goes over the back of the shoulder blade, and in most people will attach onto a little slip at the inferior angle of the shoulder blade. But of course we're using all the other shoulder depressors as well, it's just the latissimus dorsi is the most notable one. So this exercise is done in a seated position, and there are different ways to do it. But we're essentially going to be lifting ourselves up using those powerful shoulder depressors. So because placing the palms flat will have the wrist at a big angle, my preference here is to do it with a fist grip. Now of course there are going to be pressure considerations, and I'll talk about modifications in a moment. So if you try and press down into what you're sitting on, which needs to be quite firm to support the lift, and your knuckles are just saying, no thanks, well, simple solution to that, you can get something to cushion them and then place down, just make sure that they're not going to skid and slip off what you're sitting. So with the fist grip, it also provides more height with which to move into than if your hands are flat. Okay, so with the first technique, the fist grip, try and sit up tall to start with, bring the back of the head slightly behind where it started, and the shoulders as well. So you get this triangle of the back of the shoulders and the back of the head, which will move backwards to the wall behind you so that your crown is sitting over your tailbone. You feel quite elevated as you're fighting gravity here. Now with the shoulders in that neutral position, just drawn back slightly but not forcefully, you press down into your surface. And as you do that, you'll feel that your sit bones want to lift. Now if you're able to do this and actively lift the sit bones, that's the best end game. But if you find you don't have the strength, you'll still get some benefit from pushing down and partially lifting, although it might not be as effective as the full final position. So with that said, if you find it's just absolutely impossible to push down, this may not be a technique for you. But getting back to the technique in question, we push down with that neutral position, and then by depressing the shoulders, it lifts the sit bones off the seated surface, and I've got my shoulders pretty much as depressed, as lowered as they can. And the beauty of that is you're stretching the muscles which work antagonistically. Because we're utilising the muscles which press down and depress the shoulders, that sends a message to the ones above to switch off, relax, allow some movement. So you're simultaneously strengthening the shoulder depressors and relaxing and stretching the shoulder elevators. Okay, so it's a nice little way around it. If you find that the knuckle pressure is too difficult, then you can do it on the palms, but what you probably need to do is get blocks or books so that you can get that height, because from here I'm pressing down, I've already run out of arm push, and I've not really elevated my body up off the seat at all, so you might need them just raised. Duration of exercise is a source of much debate. I think the important thing is that when you're doing anything, particularly one where you're pushing up and having to use muscles perhaps which you don't use commonly, you don't want to feel any sign of fatigue, you don't want to be having shaking and a poor quality of movement, and you never want to push to failure of the muscles where you just buckle. You're just floating up and seeing how long you can hold it. I probably wouldn't do any more than 15-20 seconds if you're able to, but it might be governed just by your ability to hold for a given time. Then you can try this for 30 to 60 seconds total. With practice, it will become easier, and you'll find that the shoulder depressors will get more potency in counteracting the tension up top, and that's why this is a nice technique to have, focusing on this reciprocal relationship between muscles which have a bearing upon the shoulder.